Welcome to the secret of ultimate holistic health. Before I begin, let me ask you a question. Have you had a childhood dream? Yes or no? Yes. I had one. I wanted to become a medical doctor. Why? This is because when I was a child, I used to see my elder brother wake up from sleep either in the middle of the night or early morning with difficulty in breathing and wheezing. Every time this happened, my mother would recognize even the slightest noise and she would jump up from bed and come to help my brother. She used to do anything that was possible, like sitting him up, opening the windows, giving all the medications and everything that she could do to make him more comfortable and ease his breathing. However, every time this happened, it took a lot of time to settle. Sometimes he had to be rushed to the hospital for relief. And I was too young to offer any help. But I could see how upset my mother was because she could not see her son going through this distress and difficulty in breathing. I saw how helpless she was in her face. So, going through all this, I made a decision in my mind that when I grow up, I will become a doctor. So that I can help the people in my home in similar situations. So when I grew up, I became a doctor. And in fact, I helped many people in similar situations. Then when I came to the UK, I was surprised how much rigorous training, how many examinations, and how many interviews I had to crack before I became a medical consultant in NHS. Now, after I became a consultant, I was so happy. I celebrated every success in my career. I bought a new house, a new car, and I was living with my family happily. However, suddenly, out of the blue, I find myself in my GP's chamber having a consultation with my GP. It's 3 p.m. in the afternoon in 2004 on 4th of December. I'm sitting in my GP's consultation room with my GP sitting across. It's a typical consultation room with usual clinical decor and smell. So as I sit there, I can see through the window a cloudy winter day with a drizzling rain outside. I can even hear the wind blowing across. What a miserable day. I'm sitting inside the consultation room. I'm a bit nervous, tense, and apprehensive about the result of my routine checkup visit. After a brief chit-chat, Dr. Basu asked, "Are you all right, Sujan?" "Yes, I am, Dr. Basu." Dr. Basu continued, "But Sujan, your results are not fine. You are overweight. Your high blood pressure, blood sugar, cholesterol are all high, and your ECG report is abnormal. I'm afraid these are not good. Could you tell me, have you been at stress? Are you undergoing through stress? I was shocked with the result. I was quickly rewinding and reviewing my past few months, and I found that I was going through a lot of stress about the rigorous training, about management of the hospital activities, and so many other things. My lifestyle was erratic. I was not sleeping well. I was not taking proper rest. My food habit was not good. I was having fast food. So I was really going through a lot of stress. Having heard the news from Dr. Basu, I asked her, "What can I do, Dr. Basu, now?" She said, very softly and very compassionately, "Not to worry, Sujan. You will be fine. You need to mind your diet, do some exercise, and take the medications that I am giving you today, and I will see you in 6 weeks." I was very upset. However, I tried to control myself, my emotions, and my anxiety. Have you ever experienced something like this when your life takes a complete U-turn without any warning sign or signal? I came out of the consultation room with a heavy heart. I was thinking, what will happen to my family if something serious happens to me? What will happen to my kids? They are still in school. What will happen to my wife? She looks after the whole house and looks after the children as well. My house is still under mortgage. And where will my family live if my house is repossessed? Because I am the only earning member in my family. I was so overwhelmed with this thought, I could not think anymore. There were a lot of thoughts going in my head. I was thinking, how could this happen to me? I'm perfectly healthy and I've never been ill and I do not have any symptoms at all. Being a successful doctor, I also look after myself well. So I could not find any reason why this happened to me. Maybe I should repeat the blood tests and the ECG. I was just thinking all this in my head. I still cannot believe that these are my results. 3 days prior to this conversation, my mother came from India to stay with me for a few months. So on that day, when I came back from GP, my mother was sitting on the sofa in my reception room. As soon as I entered, she could see on my face the anxiety, tension, and worry. She could immediately read my face and asked, "What happened to you, Sujan?" I said, "Nothing, Mom. I'm fine." You know how moms are. They can read your face easily, and every time they are correct. So I thought it's better to tell her. So I said what GP told me. She looked so anxious, so stressed, so apprehensive, so fearful. I could see the same face that I used to see when my brother had an attack of asthma in the night or early morning. I could see the same face with a sense of helplessness and an anxious, fearful face. The memory of my childhood came back to me. I thought, I cannot see this face anymore. So I tried to reassure her, don't worry, mom, I will be fine. I'll take all the steps and I will be fine. I've got an appointment with my GP in 6 weeks' time. She has given me all the medications. She was very stern in her voice. She says, Sujan, take it seriously. You know, this high blood pressure, diabetes, cholesterol, all this can lead to heart disease, stroke, and you can die. So take steps now. I said, I look after myself well, mom. She said, no, you don't. Your lifestyle is not right. It's very erratic. And you don't eat well either. But mom, I go to gym. She shouted, no, you don't. You have a membership, but you go maybe once or twice a month. That's not what gym is for. I kept quiet. She kept on and on about how to take care of myself. And she said that you need to follow a TV program where an Indian guru uses 5,000 years old lifestyle secrets that are changing and transforming people's lives. I don't have time, mom, for all this. She came back and said, if you do not find time for these things now, you will definitely find time for illness. Mom, they don't work. Meditation, yoga. I've seen many people have done that, and I don't think they work at all. She said, don't argue with me, just do it. I thought, it's no point going on an argument on this issue. So I thought, okay, I have to pacify her. And at least for that, I said at that moment, okay, mom, I will do it. I tried to make sure that my mother could see my effort to change so that she gets faith in me and stop worrying about me. In that moment of desperation, I took a decision that I will take responsibility for my own health. My doctor is not responsible for my health. I am responsible for my health. So I am going to take that responsibility from now onwards. So therefore, I started doing research about what other options are there to bring back my health, my energy, my vibrancy in health, and all these things. So I did a lot of research for about 10 years. But initially, what I found that yoga and meditation, which is the important thing of Ayurvedic health, they focus on the whole person. They do not focus on illness. They focus on the whole person and they focus on the wellness. They do not ask what's wrong with you. They ask different questions. They ask, how can we improve you, your body, mind, and spirit, the whole person? They think about long-term well-being, not just cure of disease. They even think of reversing these conditions, which sometimes the modern medicines take it for granted. Some of the diseases are chronic conditions and you have to live with it. For example, high blood pressure, diabetes, type 2 diabetes, and arthritis, depression, and so on. These are the diseases that can be reversed according to Ayurvedic lifestyle. So I focused on this. I did a study and I was thinking about these options as to how to take this forward. A couple of weeks later, because of my decision and one of my friends' persuasion, you find me in a yoga class in a winter weekend in Glasgow. Me in yoga class, especially in a winter weekend where I should be lying in bed. Anyway, I am there. So ready to go for the yoga class. That weekend, with 60 other men and women of all ages, I did an extensive yoga program with yoga, breathing exercise, freehand exercise, meditation, lifestyle training, and also lecture on diet and nutrition. I got so much better after that weekend that I made a decision that I would have never made before. I decided to go to India for a 2-week course on yoga teachers training program. In those 2 weeks, I did continuously these practices from 5 o'clock in the morning till about 8 o'clock with a break of 2 hours for lunch. And I did that with 5,000 people in a big, big auditorium. After that 2 weeks, I felt so great. I felt fully energized. I felt vibrant. I felt lively. And I don't know how the stress seems to have disappeared. So I got connected to my inner self by doing the meditation. And I had a glimpse of what balance and harmony means, which I never knew what that meant. So I really, really felt so great. I cannot express. Fast forward 6 weeks. I'm sitting in my GP's consultation room with my GP sitting across. With a bit of surprise in her face, Dr. Basu asked, "What have you done, Sujan? I think your blood results may have to be repeated. I don't think they are yours." But I said, "Anyway, tell me what are the results." "Your blood sugar, cholesterol, ECG are all normal. You lost 3 kilos in 6 weeks, and your blood pressure is also normal." I smiled and I told her what I have done in last few weeks, and she was impressed. Dr. Basu continued, "Keep doing your holistic health practices, and I will see you in 3 months." After helping myself with these practices, I transformed the health and well-being of Dr. Bhadra, Dr. Mrs. Bhadra, and Miss Das, and many other people. And all of them, once they learned these techniques, they have also helped other people. Once you learn these techniques, you will be able to transform your health and well-being as well. And after that, with Dr. Badro, Dr. Mrs. Badro, and all others, inspiration, motivation, and persuasion, I came up with an idea or a program of uh, how to achieve this health and well-being. This program is called The Secret of Ultimate Holistic Health. Now, this program has called four major components of health, and these are physical, mental, social, and spiritual. In here, you can see somatic, which deals with the physical aspect of the health. This is subjective, which deals with the mental aspect of the health. The social, as you know, deals with our interaction with society and the people, and the spiritual health that deals with our inner self or higher self. So these are the programs, name of the programs that deals with individual components of health. The program that deals with the physical health is called the Exhilarating Body Blueprint. The one that deals with the mental health is called the Magical Mental Model. The one that deals with the social health is called Simply Stay Social. And the one that deals with the spiritual is called the Scientific Spiritual System. Thank you.